Hi everybody, my name is Sarah, Pearls of Wisdom and Food here on YouTube and Facebook. Well, here we go. So Dr. Perlmutter, David Perlmutter, who wrote the Grain Brain and has a new book coming out that I've pre-ordered, he has this huge screaming magnesium deficiency symptoms. So today we're going to revisit what that means. The recommended daily allowance for all women from 31 years old to 51 plus years is 320 milligrams per day. So, these are some of the symptoms of magnesium deficiency. If it only said circle one, right? Irritability, anxiety, fatigue, memory problems, anorexia, don't have that. Loss of appetite, don't have that. Nausea, vomiting, seizures, muscle weakness, muscle cramps, tremors, vertigo, difficulty swallowing, and irregular or rapid heartbeat. Magnesium deficiency critical conditions are depression, dementia, chronic fatigue syndrome, ADHD, asthma, colon cancer, epilepsy, Parkinson's disease, migraine headaches, osteoporosis, PMS, and angina, cardiac arrhythmia, coronary artery disease, hypertension, and type 2 diabetes. So, they're saying, while it's true that modern factory farming techniques are inhibiting our ability to consume the recommended amount of magnesium by growing crops in magnesium-depleted soil, the good news is that you can enhance your body's absorption and utilization of magnesium by reducing your intake of alcohol and junk foods, something you should already be doing anyway, he says. So, now I encourage you to go to David Perlmutter, MD, his website, because.com, drperlmutter.com, because he lists about maybe 60 different medications, scripts, over-the-counter, and other things that could be contributing to your lack of absorption of magnesium. Okay, so the easy part, and this is the part that I wanted to emphasize, is how we can remedy it with our food, right? Because I'm one that believes that food is medicine and medicine is food. And so if you have certain foods, you will definitely contribute, organic if possible. Almonds, spinach, cashews, pumpkin seeds, avocado, cultured yogurt, and salmon. Well, that's easy enough, right? Personally, I have spinach and yogurt almost every day, and avocados almost every other. So, this is where it gets dicey. It talks about a magnesium supplement, and so chelated magnesium supplements include magnesium aspartate, magnesium arginate, and magnesium lactate. Okay, so I guess that's what you want to have. So it can be bound to an amino acid, and it's less likely to cause nausea, bloating, or diarrhea. So, magnesium sulfate, oxide, chloride, citrate often have undesirable gastrointestinal. So, if you go to his website, you can learn a lot about magnesium. And I'm probably guilty of not taking the proper one. So when I run out of what I have, I will definitely upgrade. I know that I have one in my daily handful of supplements that I take, and then I take one with a glass of warmed lemon water before I go to bed. And supposedly it's supposed to help with muscle cramps and sleep. And so I sleep pretty good, so I don't know. But, he goes on to list a lot of the things, and a lot of them are things like Nexium, Pepside, Prilosec, Zantac, with that cute fireman, and then antacids like the Maalox, Mylanta, Tom's Rolaids, Phillips Milk of Magnesia, Alka-Seltzer, and then corticosteroids, prednisone, and Flonase, Amoxil, so Levaquin. I'm just reading the ones that sound familiar to me. And then on the other side are a lot of blood pressure medications. So it's worth a visit to his site to see if this supplement is something that could benefit your health, along with having more cashews, almonds, avocado, salmon, and spinach, which I try to focus on every day. And I'm telling you that the great big tubs, the plastic tubs of organic spinach baby leaves for $4.99 is the best deal going. I tuck it into my romaine lettuce. I tuck it into eggs. And then I have it sautéed in butter. Like tonight I'm having 3 cups of sautéed spinach, which really ends up one small little bowl of it. But yeah, and I only lightly sauté it because I still like it with a little crunch and looking that beautiful color green. So, yep, that's what this is all about. And what else do I have in my little pocket of things to know? I'm watching the Fat Summit 2 with Dr. David Hyman, and hopefully I can watch Dr. Chris Kesser. Let me see, Chris Kresser, and I know that there's an article here that in my feed about artificial sweeteners that can wreak havoc on your gut. And just remember, just because the government does something that says it's generally regarded as safe, GRAS, which is a term they use, it might not be for you, depending on how your body is, how old you are, any symptoms, any illnesses or diseases that you may have. And just because they say it's good, if there's something that's if you've got, like say there's 2 teams of doctors, one team says it's okay, and the other team says stay the freak away from it, then you might want to see where the ones that say it's okay are getting their funding. Not that I'm cynical, jaded, and bitter, but, big food, lobbyists, and pharmacology are all funded to say certain things about certain things, and they might not have your interest in mind. And so when doctors say it's generally not regarded as safe, they're probably donning a lab coat a lot of the days and going into their labs and doing extensive clinical research on these things. And, as I've been saying in a couple of my podcasts, I tend to like the doctors that do a little lab and a lot of face-to-face with their clients in clinics, and put people on different rotations of food plans or supplements or even behavior modification to get you working around all your food issues. And so I tend to think that those are the people that I gravitate to because they're doing it in a holistic, functional medicine way. So you might want to look for that sort of thing and see where that person could be getting their funding. If they're just a popular doctor that you might know. And I've always felt that kind of about Dr. Oz. It depends who's funding his show and things like that. He's getting better at it, definitely, with his food investigations. And I really appreciate what I'm learning. And, he's teaching me a lot. But remember to take everything with a grain of Himalayan pink salt and or gray sea salt. And, just investigate the source of where that person is coming from and funded from before you say, yeah, I'm signing on for this is okay for me to eat, if 9 other doctors that do functional medicine have been saying, no, you might want to find an alternative. So anyway, this has been Sarah, Pearls of Wisdom and Food. Check out Dr. David Perlmutter, MD, his website for the Magnesium, to see all the 60 scripts or over the counter that I didn't read in case you're taking something like that, it could be depleting. It's often like what they say about calcium, too, how you could be depleting it, and the many different varieties of calcium that sometimes aren't absorbed by your body and then other times are absorbed. So there's a whole world out there with just those two supplements of what the proper ones to take are. So much further than my pay grade here. So anyway, this has been Sarah, Pearls of Wisdom and Food. And in the meantime, I'll be eating grass-fed and organic choices because it's the best that I can do, because I believe that medicine is food. Thanks so much for watching. This has been Sarah again. Bye-bye for now.